One Love pediatrician Dr. Michael is with the Governor's Physicians Advisory Group, and he tells containing COVID, the group met with the Guam Department of Education a few weeks ago to discuss plans to reopen campuses.
And after the meeting, we realized that there are a lot of smaller schools, some summer schools, language schools, tutoring places, etc., that don't quite fall under DOE jurisdiction.
One such school is the Japanese School of Guam, which plans to reopen over the summer.
So we actually went on a site visit, was it just yesterday, and they were really excited to kind of show us, like, hey, this is how we're going to be socially distancing kids, like in the parking lot, what we're going to do on the way in, the sinks that they put in. And so we just wanted to see, like, are the guidelines that we're coming up with reasonable and realistic?
According to Dr. The Physicians Advisory Group has sent guidelines to the Department of Public Health and is waiting for approval. Once given, smaller institutions of learning like the Japanese School of Guam would be able to reopen, but will be kept under close watch.
Things work well. Hopefully we can kind of spread it out to some of the slightly bigger schools before having full rollout in the fall with DOE. Because we understand that parents are understandably going to be very hesitant at first to try to send kids in. And this way we can have a smaller, more manageable size to kind of work with and see what works, what doesn't work, what we can work on.
Dr. also says the group has been taking a look at other school systems in other countries. For example, places like Scandinavia, where they've been open for 6 weeks. Sweden never closed their schools, and neither did Taiwan. With Dr. saying more and more evidence is showing that children don't seem to be significant vectors of transmission for COVID-19.
Kids are getting it, but when they get it, we've already kind of accepted that, okay, they're not going to get sick as often or as severely, with the exception that kids under age of 1 and past the teen years, if they do get sick, they do have a slightly higher risk of having a more severe course. But overall, we're seeing that kids are dealing with this a lot better than the adults. And so the concern when we open up the schools is really going to be more of protecting the children from the adults that are there at the school.
Dr. stresses this is not an actual study, but rather a pilot project to see if we can open up schools safely. For Guam's News Network, Chris Barnett reports.